Hello friends, this is Dr. Vivek Nalgirkar, a devout physiologist and a teacher in physiology for last 29 years. Your NEET PG results are out and shortly the counseling will begin. I am making this video to discuss with you MD in physiology and physiology branch as a career option. Can it be a good decision and can it be a good career option to take MD physiology and pursue this as a career? Yes, of course. I took MD in physiology out of my own will, of my own choice, and then I made a decent career out of it. I've been teaching in the last 29 years, as I mentioned, and therefore, yes, it can be a good decision. I know you are trying for your own dream branch. Many people even take a drop and try to appear the second time or the third time. But okay, I wish all of you to get your own dream branch, and if not, then at the back of your mind, can you keep physiology as a second option? Let's see what are the choices available in this particular branch. Before I tell you that, I'll quote you two instances. One, recently I was talking to a few interns and I asked them, what do you think happens after MD physiology? Is it a career choice? They said, sir, what happens in MD physiology? What do you all do in physiology? Like the pricking of the finger, collection of the blood sample, those dark colored graphs, etc. Is that is that what you do after MD physio? No. MD physiology is much bigger and wider field. Okay, so it's not just limited. Those students or maybe even you are looking at this branch from the prism of that first year practical subject of physiology. No, it's much bigger than that. The other instance is recently a few friends of mine who have taken clinical branches when I took MD physiology, and they were really, I mean, clinical branches are taken to be superior as compared to the first year or second year subjects. But a few clinical friends of mine recently said, I wish I would have taken MD physiology and made a career like you did. So that made me realize that yes, this branch also has a lot of potential. So let's see what potential does it have. And the other thing that I want to mention is that I'm not telling you some hypothetical scenarios. When I mention these options, I have seen people taking these options and make good, solid, successful career out of it after MD physio. The first option is, of course, general practice. You know, National Medical Commission now says everything is clinical. You know, previously, first year subjects were called preclinical subjects, second year subjects were called paraclinical, and only the final year subjects were called clinical subjects. Not anymore. Now, every subject is clinical. All subjects are clinical. So is MD physiology or physiology as a subject. And therefore, clinical practice, this option is available. MD physiologist will be as much a clinician as any other branch specialist. You might say that, sir, general practice is also available after MBBS. So what's the big deal? Why should we spend 3 extra years? Yes, that's right. But then, you know, MBBS and general practice will have to compete with other pathies, practitioners of other pathies. Whereas postgraduate degree has a certain additional aura, some additional benefit attached to it, advantage to it. And therefore, if you practice post MD, then yes, it can be a good, successful practice. Obesity and lifestyle, second option that is available. I have run obesity clinic for a few years. It was a successful obesity clinic where I had a clinic with gym attached and physiotherapist and the other people involved, nutritionist. And then it was a successful career or at least a successful start. But then I realized I have a teaching passion in me. So eventually I deviated from it and went along in the teaching branch. But nevertheless, obesity and gym and lifestyle clinic attached to it can be a good idea. We in our DY Patil Hospital, we are running a lifestyle OPD, lifestyle clinic, under the guidance of our head of the department, and we have primary patients, means first contact patients, as well as the referrals, and it's a good setup. So this can be replicated once you take MD Physiology and start practicing in your own places. Okay, so obesity, gym, lifestyle, good options. Okay, then DM, PhD, fellowships, means additional degrees after MD Physiology. Fellowships in diabetology, for instance. There are people in our own department who have done MD Physiology and then done fellowships in diabetology, and they are doing a successful practice in diabetology. They have diabetology OPD or PhD, and that has certain academic inclination. The person who has certain academic zeal can also go for PhD in physiology, doctorate of sciences, DSc, etc. Next, aviation. Recent years, India has shown more and more potential in the aviation sector, space medicine, going to the moon and back. So it requires a lot of understanding of the body physiology, because physiology changes in the space. So physiologists are required in this field. It will have certain amount of glamour also, as even the sports and exercise science. Olympics, cricket, many other sports, they will require sports medicine consultants, where a sports and exercise physiologist will have a big role to play in the coming years. And reproductive health. My best friend, Dr. Girish Karmarkar, is running a reproductive health clinic actually in Thane, and he completed his MD Physiology, and after that he learned further in this branch, the reproductive health branch, and he's running a independent clinic, reproductive health clinic, and made a career out of the clinic, apart from the other things, of course. So next is teaching and research. If you have a passion for research, then yes, take up MD Physiology, complete your MD, and then go for research along with the teaching. You can join teaching medical college, and pursue the research. Of course, new medical colleges are coming up in India, and therefore there will be a lot of demand for MD physiologists in the coming years. So wherever you are located, there might be a new medical college, and they might offer you a good package, good salary package. So that's of course is there. Apart from that, the online and offline coaching platforms. I can tell you my experience. I have worked with almost all the known coaching platforms, online as well as offline. So they also offer good packages, and if you have that zeal of teaching, that passion for teaching, then yes, of course, this is one good option available. Finally, electrophysiology. This is an upcoming branch, but I'm not telling you some hypothetical branch. A few years ago, my father-in-law had to undergo cardiac surgery, and the pacemaker was implanted. That time, inside the OT, during the procedure, there was of course cardiothoracic surgeon, there were other surgeons, and there was a physiologist also present inside the OT, and also involved in the post-op care. Why was he there? Why was MD physiologist or physiologist was required? He was electrophysiologist. So cardiac potentials, electric potentials is a specialized aspect and specialized field in itself. So you can take some fellowship in electrophysiology and pursue in that direction further. In fact, in addition to this, there are lots of other things like EEG, EMG, electroretinogram, electroolfactogram, electrocorticogram, nerve conduction studies. All these come under the umbrella of electrophysiology. So this is also a good career option in India as well as abroad. So these are a few choices available along with the MD physiology or post MD physiology, and therefore I would say that as much as I wish you to get your branch that you are looking for, your dream branch, but nevertheless you can keep this as your second option. You can look at it as your career option. Okay, many people ask me, we want a balance of life and career. Yes, this branch can give you life and career, a good balance. There will be no emergencies, of course, except if you take sleep physiology or polysomnography or lifestyle medicine. In that case, you might have night duties. But apart from that, all these things you can have your life, and there will be a good balance of these two things. So keep this at the back of your mind. People have walked along these paths and make good careers. If you want to ask me anything on this, you can ask me in the comment section of the YouTube channel below this video, or you can contact me on any other social media platforms. But I must say, keep no doubt about this. This is also a good career option.